We are talking about the connection between sleep and mental health today, how you can optimize the way you sleep to ensure mental wellness too. Joining me this morning with her tips is Dr. Mandeep Johal, dentist and sleep expert with Family Dental in Guelph, Ontario. Good morning to you, Dr. Johal. This is so important, right? Good sleep, it is directly correlated to good mental health, isn't it?
Exactly. So let me start off by sharing a common saying, woke up on the wrong side of the bed.
Yes.
Right? We all know that.
Yes.
So if you don't sleep well, you're going to feel a little moody and emotional the next day, correct? So in my clinic, I do treat patients with sleep issues. And what I find the commonality between these patients is they all have some level of mental health issues. That includes depression, anxiety, ADHD, or hyperactivity, especially in children. Right?
Yeah.
So like you mentioned that there's a direct link between sleep and mental health, but I do want to share very quickly, it also goes the other way around.
Okay.
Patients that do have mental health issues also have a really hard time sleeping. But today we're going to focus on how we can sleep better to decrease the symptoms of mental health, right?
Okay, this is so important because folks go, I know, I need to get more sleep, I need better sleep, but how do I do it?
I know.
So let's go into that.
I just had a quick visual one to share with you guys to show you the impact sleep has on mental health because it affects even our memory, brain fog, right? A lot of us share that.
Oh, yeah.
Chronic fatigue, feeling tired throughout the day, learning ability. But I just want to go into just a little bit of science behind that to really explain to you guys how sleep affects the mental health. It comes down to our sleep cycles, right? And I'm not going to talk about all of them. There's different stages in a cycle. But the one stage I want to talk about is called REM. We all know that, rapid eye movement. And that is known for like intense dreams, right? But it also has an impact on how we consolidate our memories, especially like those positive emotional moments. That's when they get stored, is when we get into our deep REM sleep. But if we're not getting there, it's going to affect how you feel emotionally the next day and your mood, right? So that's why I have the next slide, just to kind of tie it together, is how sleep will impact your emotional health. But like I was here last time talking about mouth breathing, I'm just trying to tie it all in together. Is that's all going to impact your sleep, right? And then talking about emotions and mood, well, think about depression. Depression is a type of mood disorder. So if you're not sleeping well, right, your mood is affected, now you're worsening your symptoms of depression, right?
You know what I found also is if I'm extremely tired, as you said, it affects your mood, and then I go, I don't know what I want. Okay, I'm hungry. I'm not really hungry, I'm just tired. But you know, your brain is kind of foggy, you're not really sure what you want, your mood is affected. So think about even seasonal disorders. Think about how many people have seasonal, especially in this country. I mean, thank God it's July. But seasonal disorder is very common, and that's also a subtype of depression. So exactly, getting the right, so that brings us to our next thing is tips. I just want to share quick tips with you guys. I'm not going to read all of them, but I am going to urge the importance of routine. Think about children, how important routine is for our children. It's the same for us. The only difference is that we can have coffee in the morning and get through our day, but kids really act out. Right? So having routine is important, but also screen time. I was just talking about the segment earlier about movies, but watching these movies in the white light, the white light is not good for us. We want to have red lenses, we want to limit our screen, and I just shared a quick tip that's not on here. On our phones, we can put red light filters on them, so we're not looking at that white light, because that really affects on how we go to sleep and how we hit those deep sleep cycles. Okay, and another tip you have here is if you can't fall asleep, get out of bed, is that right?
Because what ends up happening is if you're in bed and you're tossing and turning, it's going to start creating that fear, especially if you have anxiety, then you're going to get that fear and anxiety, oh my God, I can't go to sleep, Get up, don't turn on the lights, just get up, just kind of refresh yourself, maybe do some stretches, meditation, and then try to go back to bed, because you want to keep your bed just for sleep.
You're almost like you're resetting, right? So
100%.
You do that if you're tossing and turning for about maybe half an hour, or what would you say? When you really...
Exactly, just get up, reset, do some stretches, meditation, journal writing is so great just to kind of calm that brain, right? And these are like simple tips, but like I said, in my clinic, I do help people with sleep issues. I have tons of tips on my Instagram at Dr. Mandeep Johal. I even have videos that show patients having testimonials sharing that how I've been able to help them with orthodontics to expand their airways, breathe better. And now they're saying they don't wake up with brain fog anymore. They're feeling better, especially children. Just a quick story with a 12-year-old. I want to make it really quick. He, when I first started treatment, he goes, Dr. Johal, I don't have any dreams, because one of the questions asked, especially kids. 2 years later, Rosie, he goes with me, he shares with me, he's like, Dr. Johal, I'm having dreams.
Yes.
Like, that just made me feel so great.
Dr. Johal,
yes.
So if folks want more information, they can go to your social media, Mandeep Johal, right?
Yes.
That is it. You can go on Instagram, get more information there if they want to contact you as well. For a better sleep.
Yes.
So important. Dr. Mandeep Johal, thank you so much. Dentist and sleep expert. Really appreciate you coming on.
Thank you so much.
Maybe a few more folks will have a good night's sleep tonight.